Hello, my name's Adrian Richards. I'm a consultant plastic surgeon, and today I'm going to be talking a little bit about how you select which the best plane for a breast implant is for you, and that's essentially whether the implant is best placed behind the muscle or in front of the muscle. So first of all, I'd just like to be clear about the muscle in question, and that's the pectoralis major muscle. The pectoralis major muscle runs from the shoulder oblique-wise across the chest to attach to the central part of the rib cage here. Okay. Now, there are three basic positions the implant can be placed. The first is total submuscular, which is a technique we used about 20 years ago and we don't use anymore. The second is partial submuscular, which is what we also call the dual plane position. Now, it's called dual plane because the upper part of the muscle, the upper part of the implant, is covered by the pectoralis major muscle, but the lower part of the muscle is covered by the breast gland, which is thicker in that normal portion. So when we talk about nowadays submuscular, under the muscle location, we're really talking about a dual plane, which is under the muscle in the upper part, but in front of the muscle in the lower part. The third plane you can have the implant inserted is in front of the muscle, and that's called subglandular positioning, which is underneath the breast tissue but in front of the muscle. So in all of these positions, the implant is behind the breast tissue, and the breast tissue is kept intact, so the glands and the ducts are all intact, so breastfeeding will be normal afterwards. Okay, how do you select which is the best for you? Well, the basic test is how much natural breast thickness in the upper part of your breast you have. So we tend to measure it with a caliper, and the golden number is 2 centimetres. Okay, so you need to measure the upper part of your breast here, and if that is over 2 centimetres, pinch with, just gently pinch it, not too strong, just a gentle pinch. If that's over 2 centimetres, you're best to go in front of the muscle. Okay, now 2 centimetres of a pinch width here takes in 2 thicknesses of the skin. Okay, so 2 centimetres pinch width actually means that each layer of the skin is 1 centimetre thick, and 1 centimetre thick is really the golden number for the minimum amount of breast tissue you need over an implant. So if you've got 2 centimetres pinch, 1 centimetre thickness, you're okay to go in front of the muscle. Okay, if it's less than 2 centimetres, that means you've got less than 1 centimetre of coverage of the implant, you're best to go behind the muscle. And the reason for that is that in the upper part of the breast, if you've got less than 1 centimetre natural breast tissue, you will be likely to get implant palpability and rippling, which is slight undulation in the upper part, which is visible. Okay, so advantages in going under the muscle. Basically, the breasts look the same whether you go in front or behind of the muscle. Okay, and most surgeons will do both. Okay, but on the right patient. So it depends on you what's best for you. But basically, advantages in going behind the muscle are less risk of implant palpability, possibly less risk of capsular contracture, and that's because the muscle continually massages the implant, and studies have shown a slightly lower rate of capsular contracture with under the muscle. Disadvantages of under the muscle include the fact that when you exercise, when you contract the pectoralis major muscle, the top of the implant flattens slightly and the breast distorts, and also that the recovery period is longer, so it's more painful recovery if you have to elevate and divide a slight bit of the muscle. Okay, in front of the muscle, advantages include quicker recovery period. Most of my patients are back to work within a week to 10 days, depending on their occupation. The breasts are softer and you get no contraction when the muscle contracts, so particularly with people who exercise in the gym a lot, often go in front of the muscle. Disadvantages of in front of the muscle include possibly slightly higher capsular contraction rate, and the main risk is implant palpability in the upper pole in very slim patients. So again, under 1 centimetre with in front of the muscle positioning, you're in risk of rippling. Okay, so in summary, you really need to be examined by a surgeon who would recommend what's best for you. But you can do a few tests at home, and the first one is a pinch test, over 2 centimetres of pinch, 2 layers of skin, that means 1 centimetre of your natural breast tissue in front of the muscle. Quicker recovery for you. If this distance is under 2, really there's no option but to go under the muscle, which again looks the same, but slightly higher, slightly longer recovery period. So I hope that's clarified some issues. If you'd like further information, we have done podcasts on this topic, and I've talked to eminent surgeons discussing their views on this, and that's available at the website. Or come in to see me in the clinic, or one of the other surgeons or nurses, and we'd be happy to discuss what the best option for you is. So thank you very much.